There's some really basic things that women should do before they become pregnant. Very simple, obvious things like eating healthy, sleeping well, exercising regularly. All these things will ensure that you're healthy before you conceive and will also maximize your chance for pregnancy as well. I also encourage women to take this opportunity to live healthier. So aside from those things, quit smoking if you're a smoker. Certainly avoid all alcohol or any illicit drug use. And also set up a doctor's appointment just to talk about preconceptual issues that may be pertinent to you specifically. That way, if there are any particular risk factors that are present, we can try to minimize or eliminate those things to ensure that your pregnancy is going to be healthy from the very beginning. During that visit, it should be a fairly extensive visit. There should be a complete history taken of your general medical health. Your family health history is also really important. Go over your list of medications that you're taking on a routine basis. This could be a prescription medication, it could be herbal supplementation, which a lot of women don't think about, or over-the-counter medications. Now, it doesn't mean that when you're trying to get pregnant that you need to stop all medication use, because it's not feasible to do that in a lot of the situations. So if there are health issues that need to be addressed with medication use, you just want to make sure that these are the appropriate ones to use during pregnancy. And sometimes you can have those medications adjusted to minimize its impact on your pregnancy as well. And I always tell women to not just stop your medications on your own. Please talk to your doctor about it beforehand, because suddenly stopping a medication could also have some serious consequences as well. So aside from the history, going over your medication list, there should also be a physical examination done. Make sure that all of your screening testing that should be done, such as your pap smear, your cervical cancer screening test, is up to date. Ensure that the uterus does not feel unusual on exam and be involved in things like fibroid tumors or things like that. And then to also probably have some basic lab tests done. Looking at your blood count, make sure you're not anemic or could potentially be carrying some thalassemia, anemia issues. Make sure your vaccination is up to date. A lot of women also don't think about their vaccination status. You think that's something that's only relevant to children, but it really is relevant to women of all ages, and particularly when you're trying to conceive. Make sure your chickenpox is up to date, your tetanus booster is up to date, hepatitis is up to date, your German measles or rubella vaccination is up to date, because these viral illnesses during pregnancy can also have a serious consequence. So those are a couple of the things that they should be going through with you during your preconceptual counseling and visit.